Okay, everyone, welcome back to another episode of ICU. Today, we are going to dive into all things endometriosis, maybe even sprinkling in a little PCOS and fibroids. So I just wanted to welcome our guest. It's LJ Johnson, and she has a ton of different degrees, and I'm going to let her tell you guys all about that.
Yes, thank you so much, Callie. I'm excited to be here to talk to the endo community and the IC community. So, like she said, I'm LJ Johnson, the holistic hormone expert. I specialize in everything endometriosis, PCOS, and fibroids. Specifically, endometriosis is my favorite. I know it's kind of a weird way to say it, right? But it took me 16 years to get my own diagnosis of endometriosis. So, as I was trying to get that diagnosis, I was doing all the training, functional medicine, doctorate program, psychology. So, like she said, I've got all the degrees and the accolades. I don't even really focus on those as much, right? What I do say is I don't come from the high horse of, listen to me because I have all the degrees and I've been to medical school and this, that, and the other. I come from more of the low horse, which is kind of how I put it, not the high horse, but the low horse of I've been there, done that, right? Like I've been there, I've been in your shoes. I've been that person, crying in my car because, I felt like, I was being dismissed. I've dealt with the gaslighting. I've dealt with all of the pain and the suffering and not having the community. So yeah, all the education aside, I mean, I am just an endo warrior that's spreading awareness and really wanting to empower and educate you that you can have an amazing life despite your diagnosis.
Love that. I think it really makes you a better coach if you are a sufferer of the condition that you specialize in. So that applies to both of us. And I do think that
right.
It helps our clients that much more, and it just helps people relate to us more. And I think that's amazing. So you did have some struggles with endometriosis. Can you chat a little bit more about that?
Absolutely. Yes. So I started my cycle, right? Nothing on these podcasts or TMI. So get ready to jump all in, LJ.
Yes.
Yeah. So I started my cycle when I was 12, but I started having the issues with endometriosis and the symptoms at the age of 14, right? So it started with painful periods, nausea, passing out during my cycle, always being bloated, hot flashes. Let's talk about being 14 years old, already feeling weird in your own body because you had this period, which everyone says is
Right.
like your, motherhood and womanhood, but you're like, this is kind of miserable, right? Not to mention my body, right? Having hot flashes and all these things. And then just being like that awkward person, right? 14 is a very awkward age as your body's developing, your period's there 1 second, it's not there the next, and it's floodgates. So for me, it was a really challenging period. The first 2 years, everything was kind of cool. And then all of a sudden at 14, everything fell apart. I remember complaining to my mom, having conversations with her. And the biggest thing that I got from her was, you're a strong Black woman, you don't feel pain, right? And so at that moment, I was told, you're the oldest of four, you're a strong Black woman, just keep pushing. And so I began normalizing all of these things. I thought that, and not saying that endometriosis is period pain because it's anything but that, but for me, I just figured, this is how it is, welcome to womanhood, this is how it's going to be. And it was anything but that, right? Like all of the symptoms that I normalized, yes, they were normal for me, but they weren't things that were supposed to be happening. So like I said, it started off with the painful periods, a lot of bloating, a lot of brain fog, and just a lot of systemic inflammation throughout my entire body, right? So this is probably a good time to just describe the symptoms of endometriosis, right? Because endo for LJ may be different from Susie Q, Callie and everyone else, right? So endometriosis, it's a toughie, right? So I'm going to say the definition, work with me. It's a lot that's packed into it, right? So endometriosis is uterine-like tissue. I always have to say it 3 times, a little louder for the people in the back, right? Endometriosis is uterine-like tissue. One more time. Uterine-like tissue found outside of the uterus, right? It is not a reproductive disorder. It is not a painful period. However, there could be pain during your period in your cycle. It is chronic systemic inflammation throughout your entire body. And then if that is not enough, let me just add the icing to the cake that it has autoimmune-like factors, right? So saying all that mouthful one more time, uterine-like tissue found outside of the uterus. It's not a reproductive disorder, chronic systemic inflammation throughout your entire body. It is hormonally driven, right? And then it has those autoimmune like factors. So when you take all of that and put it together, that can be painful periods, heavy cramping and bleeding. Now, this is the other thing with endometriosis, right? That painful period, those cramps and things like that, that can happen outside of your cycle, right? And that's one of the biggest things with endometriosis. If we could just get away from that mindset, which is not just a mindset, but if you go to Dr. Google right now, right, it will probably say uterine-like tissue, or it will say uterine tissue, and it's not, it's uterine-like tissue, right? So that pain can come outside of your cycle, right? It can be anything from chronic, acne, hormonal acne, brain fog, migraines, vision issues. Sometimes you may have, nosebleeds. I had rectal bleeding. Like there can be tons of things, right? All the non-sexy stuff, that is endometriosis, right? And if you just remember that with that chronic systemic inflammation, it's throughout your entire body, right? So there are people that have endometriosis just in their pelvic region, right? Like you could have it in your thoracic area. Maybe, for me, I was coughing up blood. I was getting really inflamed in my lungs around my cycle when my hormones were, all over. Those endometriosis lesions can be anywhere in your body, and they can cause that chronic systemic inflammation anywhere throughout your body as well.
Okay. That was a lot.
It is a lot. It's definitely a lot.
Yes. And I know we stopped in the middle of your story, but I already have questions. So are there certain risk factors that put someone more at risk of getting endometriosis?
Right. So there's still, oh my gosh, right. Let's talk about the lack of research. Research is there, but we need so much more, right? So
You
far,
are
no
preaching
cure.
to the choir. IC is like
Yes.
even lesser known than endometriosis. So we know.
Right. Absolutely right. So there are some, there's different camps and different ways to look at it, right? Some people, some predisposition could be autoimmune, right? When your immune system is already under attack. I know for me personally, I was diagnosed with asthma and allergies as a child. Now, the question is what came first, the chicken or the egg, right? Sometimes those autoimmune-like factors and those diagnoses can be there and it predisposes you. Then there's other sides of the camp where they're like, they've seen endometriosis, lesions and cells inside of, embryos or young fetuses, right? So it was already there, and then something in your lifestyle. So it's almost kind of like, your body, your genetics may load the gun. I hate to say it that way, but your, predispositions and different things like that, and then just other genetic things. And then your environment, your lifestyle can really pull the trigger on that, right? So there's still no real, concrete answer as, these two things called endometriosis, these, one or two things. There's just so much more research that needs to take place.
Okay. Yeah. And we know that endo and IC have a major crossover. They're the evil twin.
Oh my gosh, yes.
What other conditions are commonly associated with endo?
Right. So a lot of the endometriosis patients that I work with have PCOS or fibroids. I see a lot of endo and fibroids, right? And that not everyone that has endometriosis or fibroids is estrogen dominant, but definitely when that estrogen is there and not as balanced, you can have both of those, right? Endometriosis is also really just tied with a lot of autoimmune issues, right? Whether you got the Hashimoto's or hypothyroid or all of these things, the diagnosis first, there usually is a lot of that wrapped in, right? Usually a lot of asthma and allergies, a lot of just anything that has to do with inflammation, right? It could be endometriosis and IBS, endometriosis and Crohn's and colitis, endometriosis and arthritis, MS, fibromyalgia, right? It's all the itises, right? Anything with the itis, it really does, just bring in all that inflammation. And once that's not addressed, or really, I want to say under control, it can really just start to impact your world.
Yeah, I could imagine how it impacts each person differently. I mean, you said you were coughing up blood. Like that's got to be alarming as a young woman.
Right. And especially, so what it is for me, I think for my personal story, and my heart goes out to anyone, I don't want you to have another diagnosis. I think it was maybe a little easier for me to get some treatment in that area as far as the thoracic, because I had already been diagnosed with asthma, right? So I already had the inhalers, I had the nebulizer. So they were already kind of on high alert, right? The first 7 years of my life, I was literally in and out of the hospital 24/7. To the point of when I was younger, every time you went to the hospital and you were admitted to the hospital. So not just a visit, but when you actually had a stay, they gave you a puppet, right? I have a treasure chest of over 428 puppets, right? From the age of 0 to 7, right? So that's a lot of visits, right? So that's a lot of overnight stays, a lot of asthma, a lot of allergies, a lot of issues. Like my body was always inflamed. And the other thing I will say with my endometriosis diagnosis is it was really interesting. All the asthma meds and everything that I would take, everything would work. But once the endo flare hit, there was none of my medications worked, right? So it was almost like 2 weeks out of the month, everything was, manageable. It wasn't great, but I could take my inhaler, I could take the pills, I could take everything. But once the flares would hit, none of my medications would work, right? Like everything would get so inflamed. Those lesions would literally get so pissed off that I was not able to really, manage it. And then it would just start to shut down my systems literally one by one.
Mm-hmm. Yeah. So in terms of symptom crossover with IC, can you talk a little bit more about that?
Yes. And I can relate to the IC as well. And maybe I'll have you define IC, right? Because maybe some people are listening to this because they're like, oh yeah, endometriosis. And they're like, hold it, what's IC, right? Because
Right.
sometimes
Followers. Mm-hmm.
Yep.
Yes. So IC, or interstitial cystitis, is also
Yes.
referred to as painful bladder syndrome. It is a chronic bladder condition. We have no known cause, no known cure as of right now. Tons of research still needs to be done. And there are theories on what causes it, and autoimmune is one of those theories. But it seems as we progress through time, it seems that there are subtypes emerging. And so someone may be that autoimmune category. Someone could be a pelvic trauma type subtype, or nervous system is upregulated. Like that's kind of where we're at. So was that sufficient as a little?
Yeah, that's good. That's good, right? That painful bladder, right? So for me, it's really interesting to be on this podcast because I dealt with painful bladder, right? But didn't get the diagnosis, right? For me, I was that person that always felt like pins and needles were dancing on my bladder, right? And there were some endo lesions, right? But I also believe, IC may have been undiagnosed. Like you said, there's a lot of research there. And especially, I'll just be honest, anytime you say pelvic pain or period pain or cramping, they're just like, you need some birth control, right? So the fact that my bladder was in the same area, it just kind of got swept under the rug. Like, oh yeah, she's always complaining of pain down there, like let's turn off that period. But for me, it was always pain. It felt like pins and needles on my bladder 24/7. And the issue would be is that, I'd go in and they'd be like, I remember my doctor being like, you have all the symptoms of a UTI, but the culture is not a UTI, right? So I want to kind of just bring you guys to that, right? Just because it feels like a UTI, there may be the painful urination, the pins and needles, the fact that your bladder is full, but you can't quite empty it, and all of the things that come with the UTI. But this is the thing, right? When the culture is not coming back with the bacteria or something, right? And they still give you the antibiotic, that's when, like you said, it may not be as popular or well known, but you may want to throw that term out to your doctor, right? You may want to see what's going on. And that was definitely my case, right? I was put on God knows how many rounds of antibiotics because I had a UTI-like pain, but a culture that didn't line up with it. But my doctor felt so bad because I was coming in 24/7, right? And I was a fitness professional, right, as well. So not just traveling the world, doing all this psychology and stuff, but I was on stage jumping around, doing plyometrics, trying to do jump rope, shooting all these videos as a master trainer. And it's kind of hard to do all that when your bladder is on fire, right? Now, let's not even talk about how your girl had an inflamed pelvis and was like doing plyometrics, right? That probably wouldn't help in my healing journey, right? But despite all of that, right, there was a lot going on with my body, right? So there's a lot of those symptoms. And I know for some people, even just listening to myself talk, right, it can be overwhelming because you're like, okay, is it endo? Is it IC? Is it a little bit of both, right? This is the thing, right? That is why you need to join communities, right? That is why you need to be listening to these podcasts. Maybe you can find us on Instagram. I'm sure we'll put all the links to our Pinterest and our IGs and all that stuff, right? But you need a community because so many times you're dealing with this on your own and you just don't know exactly what it looks like. Not to mention, endo can look so different for every endo warrior, right? I don't know if there's IC warriors. I'm going to just throw that out there.
There are IC warriors.
Warrior. Yes. Yeah. So it's an IC warrior, right? So maybe you have the pins and needles, and sometimes maybe you do have a UTI, right? Sometimes you only feel that tension around your cycle, right? For a lot of us, there's that pain and tenderness 24/7, right? And that's kind of where the endo and the IC, right, where we have to change that mindset that it's a period problem or it's just a UTI problem, because this pain can be debilitating 24/7, right? It may tick up when your hormones are more imbalanced or when you're having those fluctuations, but it's really being able to identify. And that's when you need a good, I mean, you need an OB-GYN, right? But you also need someone that really specializes this, right? So you need maybe that specific urologist, the gynecologist, urologist that can do some of those things, right? Or having that endo specialist that can really identify that, right? Those doctors that aren't just siloing everything and separating that painful bladder from painful sex, from the back pain, from the acne, someone that's able to, and really what I do with my patients is bring that all together, because it's a full holistic approach, right? And I see, just like endo, affects everything, right? It affects your physical health. It affects your mental health, right? It affects your financial health. It's hard to, let's talk about it. It's a holiday weekend. You want to go out and have fun. How much fun can you have when your bladder's on fire, right? How much fun can you have if you think you want to go to a pool party, but you're like, oh my gosh, hope the myrcene period doesn't hit me while I'm out and about in the pool, right? Like, it wears on you physically, but also mentally, right? Financially, when you're missing those days from work. I mean, I just had a patient recently and we really did the math, and she was just like, I'm trying to step into my job. I'm trying to do this, that, and the other. And she was like, I don't know what's going on. So I'm like, well, let's look at it, And at the end of the day, yes, she was a full-time employee, but with endometriosis and fibroids, she was missing 10 days of work a month. She hadn't realized that, right? 10 days a month, that's 2 weeks. So at the end of the day, if you're working somewhere and they're expecting you to show up 4 weeks out of the month, but then with all of your illnesses and flares, you're missing 2 weeks of work, that's probably why you're not able to move up in the company, why you can't step into that promotion, why you can't take yourself to the next level. And so sometimes it really just, takes some humbling moments of just calculating, right? Like, is it really just a physical health issue where you can just put it over there? Or is it affecting your finances, right? Is it affecting your family? Is it affecting your mental health? I mean, it all plays a huge, huge role.
Yeah, absolutely. And something that you said earlier about pelvic pain kind of had me thinking. I run into a lot of people who ask me questions or they tell me they have pelvic pain, but I'm like, okay, what does that mean? Like, do you work with people on like helping them describe what they're feeling? Like,
yes.
Talk about that.
Sometimes you just don't have the words, right? And so I've been there, and this is huge. I do a lot of this with my patient when it comes to advocating for yourself, right? Now, what I will say right now is, first tip on advocating for yourself is be able to document what's going on, right? Let's say you have an appointment July 4th. I don't know. July 4th is a holiday, but we're just going to throw a date out there. Let's choose July 5th, right? More realistic. You have an appointment July 5th, right? Now, going into the appointment on July 5th and being like, I have painful, sex, I have period pain. Those are the only two things. It's hard for your doctor to really help you, right? They need more information. What you want to do is bring in documentation. On June 15th, I felt this. June 18th, I didn't go to work because I was cramping and bleeding so bad I couldn't go in. June 27th, I felt a sharp pain in my back on the left-hand side, nerve pain, right? The more specific you can get, I think what happens is when you're dealing with pain as a chronic illness warrior and you feel like you're in pain 24/7, you don't really, you're just like, I'm just in pain, but they need more specifics, right? So being able to document what's going on, right? The more specific you can be, the better, right? Now, I know for me recently, I had a little bit of pain in my stomach, right? And so it's easy to be like, call my GI doctor and be like, yeah, there's something wrong with my stomach. Okay. Could we get a little more details? Like for me, I was like, there's something going on to the left side of my belly button, right? Like I feel something going on right there. I'm feeling a sharp pain. Like be more specific as to exactly where the pain is and when it's happening. Create a timeline, right? Is it something to where, every time I'm stressed out, I feel a pinch in my back, every time I'm stressed out, my bladder is seizing up, right? Every time, I'm around, I hate to say it, certain people, every time I'm at work and I'm on a deadline, like, is it stress? Is it, probably a combination of everything, but being more specific Also, when you're working with a pelvic physical therapist, for me, it made me more body aware, right? Sometimes I was like, my bladder is hurting, my pelvis is hurting. And it wasn't that. It was maybe, a certain muscle was tight, right? Maybe there was some referral pain coming down from my hip. As a cyclist, right? I'm always cycling. I love Peloton, all the fun things, right? But it was like sometimes I'm like, I'm having pelvic pain. No, it wasn't really pelvic pain. It was a tight hip flexor, right? So also being aware of your body. And I know for me personally, I love my parents, don't get me wrong. I love my mother, but I don't know that she'll ever understand exactly what I do, right? She just knows that I talk about my painful period, which it's not anything, it's anything but a painful period. But just the body awareness and knowing your body, I know for me personally, my mother, I just wasn't really aware of my body. It's like I had a period, I didn't know the parts, the vagina and the vulva, like everything was just, everything down there, down under, all these terms, right? But really knowing your body, becoming body aware, and then going to those appointments also when you're stressed out and you're in fear. I know for me, I would get a lot of anxiety, just knowing that appointment's coming up in 5 days. I'm already stressed out, thinking the doctor's not going to believe me. Oh my God, I got to explain my story again. Having that stuff written down, right? Having that timeline and bringing someone with you, right? Especially if you're going in and you're in pain, there's nothing worse than going in and being in pain and being frustrated, right? And especially if you're at a doctor's appointment where they only have 7 or 10 minutes and you spend 6 of those crying, right? Or 6 of those, like cussing under your breath and frustrated, having someone there to support you. I know that's a lot of information for your question, but I think it can be really helpful, right? But the body awareness is knowing your body, right? Not just saying, the pain down there, but exactly where is the pain, when it's happening, and documenting it can be huge.
Yeah, absolutely. I tell everyone I come into contact with, track everything, go to your doctor,
Yes.
have all of this data there so that they can help you in the best way that they can. I think that's so important. So if somebody is listening to this and they think, oh crap, I might have endo, like what would that person need to do? What would be the steps that they would take?
Right. So if I could go back in my journey, right, as soon as I knew that there's something going on, right, talk to your doctor. And here's the deal.
Which
Sometimes you may talk to, right. So maybe you're just at, so this is what I say, talk to your doctor. Maybe you're just at your regular PCP, right? Maybe your annual exam is coming up and you've never had any OB/GYN issues, right? Maybe you're just at your primary care, your family doctor. Talk to your doctor and explain to them what's going on, what you're feeling. And I always find it helpful to suggest, hey, if it's your primary care, do you think I should see an OB? Do you think, there's something going on with my bladder? Like almost, it's not, you're not telling them it's above their pay grade, but you're suggesting maybe you need to go to a specialist. The thing I would say, the quicker you can get to a specialist, the better, right? Now with your OB/GYN, as soon as you say pelvic pain or anything like that, birth control is going to be rolling in their mind. But it's taking a step further, right? And if you have that documentation that, hey, when I'm on my cycle, when I'm in a flare, I'm having a nosebleed, I'm having this going on, with my rectal muscles, I'm having incontinence, I'm having this, that, and the other. When you start throwing out some of those terms, right, it kind of helps your doctor start thinking, yeah, we need to bring in a specialist, right? So it's talking to your doctor and then getting to a specialist, whatever that may be, right? Now, as an endo warrior, it affects everything, right? So you may need a dermatologist for some skin issues, right? You may need pain management. You may still need to see a urologist for this, that, and the other. But it's being able to get to a specialist because endometriosis, it's a toughie, right? It's not going to be something that your primary care, it's not going to be something even your OB/GYN is going to be able to work with. You're going to need to get into an endo specialist. Now that's like a whole nother, podcast and an IG
Right.
live talking about, the insurance and all of the things that you have to go through, but being able to verbalize to your physician, telling them what's going on and be honest, right? Be honest with them. But here's the deal, right? If you're talking to your doctor and you can't get answers, if you can't get the referrals, it's okay to fire your practitioner and find someone that will listen, right? And I think that's very challenging for some women, or anyone, because you're just like, oh my gosh, everyone in my families went here. They delivered all the babies since my grandmother, they delivered my aunts, my uncles, my everybody. But here's the deal. If they're not listening to you and you do not feel heard, or you're living in pain 24/7 and the, things that they're suggesting, or, AKA the Band-Aids, the supplements, the pharmaceuticals are not getting you some wins, then it's time to talk to someone else.
Mm-hmm. Yeah, so important in any aspect of your health. I think it's important to know that you can fire your doctors or whoever
Yes.
it is that you're seeing, I think that's so important. Okay. So now, I'm familiar with the whole laparoscopy procedure. Is that a diagnostic procedure, or is it a treatment, or is it both?
It is diagnostic. So like you said, it is the golden standard to be diagnosed with endometriosis. So there's lots of things out there where people are like, my doctor did an ultrasound and MRI. All of those things can be helpful, but the golden standard to be diagnosed with endometriosis as of now, and my stance, is the laparoscopic procedure, where they actually go in and see what's going on, right? Now, the golden standard to have it removed is excision surgery, which preferably should be done by an endometriosis excision surgeon, right? Not just your OB-GYN that's like, oh, let me go in there, LJ, and see what I can find, right? That's a little different. You want someone that eats, sleeps, and breathes endo. I say that, and I know it makes us laugh, but you want someone that is in the game when it comes to endo, right? So you want to have that diagnosis, but laparoscopic procedure is not going to remove your endometriosis, right? And I'll take that a step further. Sometimes, people are recommended to get an ablation, right? Going back to my example and my definition in the beginning, right? Endometriosis is not inside of your uterus, right? So burning the inside of your uterus, right? And burning those lesions, it's kind of like if you have weeds in a garden, right? Going out and mowing your lawn will get rid of the weeds this weekend, but they're going to come back bigger and better next week, right? So that's kind of ablation, where you're just burning that top layer. If you really want to get those weeds, honey, you're going to need to get on those hands and knees, right? Get them gloves out and pull the root out, right? And that is literally what the excision surgeon is doing, is excising and cutting out those endometriosis lesions. So that is a really, really good point, right? Because I had so many people come into my DMs and they're like, hey, I had a laparoscopic procedure. And yes, sometimes when you have a laparoscopic procedure, your doctor may remove some of the endometriosis lesions, but that is not the same as excision surgery, right? And then, only to make it more complicated, did I mention, just because you have excision surgery this year, last year, 5 years ago, does not mean the endometriosis cannot come back. And that's really where I come in and specialize with the functional medicine, because you've got to make a lot of lifestyle changes, nutrition changes. Surgery can't help you with quality of life, but it doesn't cure you from the endo. And just because you have excision and have it removed does not mean it can't come back.
Okay, got it. That makes so much sense. So
Yeah.
you never really cure endo because it's chronic, right?
Correct. Right. And so I know it's negative. I hate to say it, but there is no cure for endo, right? But I'm going to come back with my caveat, right? And not just using myself as an example, but you can have quality of life. It's just, you have to have the information. I always talk about the toolbox. You have to have the tools in your toolbox, right? To minimize the flares, right? I just did an Instagram thing. I'm sure you guys, I'll have my Instagram attached, and I was talking about a pain-free period. And in the comments, people were like, it doesn't mean that everyone's pain-free. Exactly. Not everyone's going to be pain-free, but what I want you to wrap your head around is, just because you have endometriosis, IC, fibroids, whatever it is, does not mean that you have to be in pain 24/7. The fact that there is no cure, the fact that there's no pharmaceutical that you can get today that's going to turn everything off, doesn't mean that you're going to have to be miserable for the rest of your life, right? What it does mean is that you have to put tools in your toolbox for your quality of life, and keeping in mind what looks like quality life for me, what looks like quality life for Callie, and you may look different, right? And so that's where I really like to bring in a full holistic approach, looking at the nutrition, the mindset, the lifestyle changes, because for me, the endo journey was tough. It was 16 years of not knowing what was going on with my body. And then after that, I'd lost out on so many things, right? I had lost out on relationships, time with my children, lost out on life, lost out on money, lost out on mental health, right? Dealing with depression and anxiety. I wanted to take my power back. And so for me personally, I had to get sick and tired of being sick and tired, and then find people in my support system, find, the education, go to the conferences, all of those things, the information that I impart to you guys during my coaching and my programs, because I was tired of just letting endometriosis win, right? It can be very discouraging. It's a lot going on with your body, but you have to kind of decide when you get to that point of where, okay, endo may be my diagnosis, but I'm not going to let it define me.
Yes, perfectly said. It sounds like endo and IC are just so similar in that, you
Great.
can manage them. Some people can go into like a remission type state, and it's not a death sentence. I always say that. Like you and I are great examples. We are out here living our best lives. We have these conditions, but we're not letting it hold
Right.
us back. We have the tools in our toolbox and we're out here helping other people, hopefully getting the same end result. So if somebody wants to work with you, how can they find you? What are you offering? Give us all the deets.
I know. She said, give me the deets. Yes. Well, the best way to get in touch with me is we'll put the link for the free discovery call, right? So I do a 10-minute discovery call. I have to be honest. I love all things endo. That 10 minutes may turn into 25, 30 minutes of free. Don't just work with me. Yeah, your girl gets fired up, right? I love the tough cases, right? So hop on the free discovery call with me and see how I can support you, right? Sometimes it's nutrition. Sometimes we need to make some lifestyle changes. Sometimes we need to bring in some functional testing, test those hormones. There's so much that can be done, but you have to have an open mind and be willing to do the work, right? I can want it for you all day. And don't worry, sometimes maybe you have the want to, but you don't have the energy. Trust and believe. I bring this LJ energy to all my patients, to all my calls. So I've got enough energy for the both of us. But yes, booking that free discovery call is the best way to get started with me. Sometimes, it's just a couple of appointments to kind of set you up with the framework. There's other times where maybe you need a little more support, right? So I've got 3, 6, 9, and 12-month packages for one-on-one coaching. And you really have me on speed dial, right? You've got my personal number, and you've got me there to support you through the journey, because it really is about deciding that you're tired of living in pain, right? That you're tired of living in, and hiding in plain sight. You're tired of letting life pass you by, right? You're tired of this chronic illness really taking your life and just really hushing you down, right? It's sitting on top of you. It's pushing you down, and you've got to really push that to the side, get that firm foundation. And so that's what I really help you do. Not just giving you the foundation and giving the framework, but giving you the tools that you need to modify along the way, right? Being able to pivot. Everyone's coaching is different. I'm very hands-on with my coaching. It's not cookie cutter. The nutrition that works for me may not work for you. So I like to personalize everything, because like I said, endometriosis is very individual as far as the symptoms and the diagnosis. Therefore, the treatment needs to be the same.
Yep. Same.
Yes.
I love your energy. Thank you so much for coming on. I know you need to get on with your day, so we'll definitely have to do something else down the line, but I will plug all the links in. And yeah, just thank you so much for coming on and doing this.
Thank you. Thank you for having me. But yeah, I have a podcast coming out as well, so I'll definitely have to grab you. I'll send you the details and have you over. I would love for you to share with my community as well, because there's tons of similarities. And I know that both of our programs can be very supportive of their journey.
Absolutely. Perfect. Sounds good. We will be partners moving forward.
Yes.
All right. Sounds good, LJ. I hope you have a nice rest of your day.
Absolutely. Thank you.
Great.